everyone, welcome to Macleod's Medlive Scientific Session Summary. Today we are at CSICON 2019 Delhi. I am Dr. Rahul Kotwal from medical team of Macleod's Pharmaceuticals, and today we have Dr. Pranab Bhattacharya with us, who is a practicing interventional cardiologist at Guwahati, Assam. His area of interest are coronary interventions, cardiac implantable electronic devices and structural heart interventions. He is Associate Professor of Cardiology at Guwahati Medical College and Hospital, Guwahati. Sir has delivered a session on syncope of unknown origin and what are the challenges in evaluation and management. So sir, first and foremost we welcome you to our channel.
Thank
and before proceeding to our discussion, I would like to ask a basic question, that what is syncope of unknown origin?
So, syncope is basically a symptom. There is transient loss of consciousness when a patient faints, what we in simple language, if you call it is a fainting attack. So, there is transient loss of consciousness followed by spontaneous recovery of consciousness.
Right.
And it is the basic underlying mechanism is cerebral hypoperfusion. That means when the blood supply to the brain is diminished, so we get attacks of syncope. So, although it is one of the very common symptoms which is encountered in the emergency department, and but it has been seen that almost fifth to half of the patients still remain undiagnosed. That is what we call as the syncope of unknown origin.
Okay.
So, after we start evaluation of these patients, so after the initial evaluation, by initial evaluation what I mean is a thorough history, a focused physical examination and an electrocardiogram or an ECG. If after this the episode of syncope lies or is etiology cannot be ascertained, then it is possible that we are dealing with a patient of syncope of unknown origin.
Great, sir. So, sir, what are the challenges that we face in our day-to-day practice in evaluation and management of syncope of unknown origin?
Yes, this is a good question. There are four major challenges actually. First is the diagnosis of syncope, which is very important, because unless we can establish a diagnosis of the episode of syncope, further management would be difficult. So, diagnosis is one aspect. Then once we come to know that a particular patient has an episode of syncope, the next thing is to risk stratify. That means what are his chances of having an adverse outcome or an adverse event related to this syncope attack. So, next is risk stratification is very important. So, by risk stratification we can use, there are various scores which can be utilized, or there are certain risk markers by which we can determine which patient may be at high risk for an adverse outcome, or like he may have a fall and get injured, or even maybe life threatening conditions which should not be missed. So, risk stratification is important in the sense that if we can detect the low risk subgroup of patients who can be advised and discharged, then we can save on the cost of hospitalization and further unnecessary investigations. And it is equally important that we identify the high risk group of patients, so that they can receive, by high risk we mean usually underlying structural heart disease, and so that these patients can receive the appropriate treatment for their condition.
Okay. So, how do you manage syncope of unknown origin, sir?
So, syncope management, syncope of unknown origin, its management is quite challenging, and but once suppose there are certain patients where even after extensive investigations cause cannot be established, but certain patients when even if they are at they may be at a high risk for sudden cardiac death, and these patients, it has been seen that they may benefit from an implantable cardioverter defibrillator or the ICD implantation. Then certain patients, after extensive evaluation, if we find that a bradycardic event is the cause of the syncope, then maybe they may benefit from a pacemaker implantation. So, these are certain guidelines by which these patients need to be managed.
Okay. Thank you for the beautiful insights and summarizing your session, sir, and I also thank you for being a part of this channel. Thank you very much.
Thank you so much.